Welcome to a brief overview of the DOMINO-HD study, where we will describe how we have incorporated PPI into all aspects of our research. I'll start by describing the research in the study and why we are doing it. Our group is interested in Huntington's disease. This is an inherited neurodegenerative disorder that causes a progressive loss of function in movement, thinking and behaviour. There is currently no cure, and whilst there are medications available that can help treat some of the symptoms, there are no therapies available that can slow down or stop disease progression. However, there is growing evidence that both environmental and genetic factors may have a role to play in determining how quickly the disease progresses from one person to another. DOMINO-HD is a European consortium study led by Monica Besser at Cardiff University and includes 5 other partner sites across Europe. The overarching aim of DOMINO-HD is to identify key environmental factors that may be responsive in targeted interventions with a view towards optimising disease management for individuals with HD. To do this, the study is split into 3 main parts. Initially, we will develop a digital sensing platform and integration and implementation framework. This involves developing methods for data collection of lifestyle factors using remote monitoring technologies and additional work to validate the use of commercially available monitoring technologies that we plan to use in the next part of the study. Secondly, we will undertake a 12-month observational study to investigate the interplay of lifestyle and genetic factors on HD symptom progression. This will take place at the 5 different clinical sites across Europe, involving the recruitment of between 300 and 450 participants. We will be collecting data on disease symptoms, nutrition and genetic information at baseline and 12 months. Additionally, there will be continuous collection of data on physical activity and sleep across the cohort using Fitbit devices. Lastly, we will take all the information we have gathered in the second phase and use predictive modelling of disease outcomes. This will then inform the design and development of a cross-cultural data and theory-driven lifestyle intervention aimed at improving quality of life in people with HD and that can impact on disease progression. It is our intention that this intervention will be co-designed with significant input from our PPI representatives. Importantly, the work described is underpinned by an additional work package which specifically involves the incorporation of public and patient involvement. Indeed, the initial study concept was supported by input from a number of stakeholder events and PPI activities focusing on lifestyle and physical activity in people with HD, undertaken by the consortium lead and in partnership with the HD Involving People group and Brain Involve. We understand that in long-term studies of people with challenging conditions, particularly when asking participants to engage with unfamiliar technologies, successful delivery of the study is dependent on participant-centric, acceptable design. We therefore sought to work together with our PPI representatives from the outset. The multinational nature of the DOMINO-HD study requires cross-cultural PPI input to ensure relevance of the study in each partner country. This presents some challenges for effective communication and inclusion across all countries. To address this, we have implemented a hub-and-spoke model with a core PPI group featuring representative volunteers from all 5 countries involved in DOMINO-HD recruitment. They act as a conduit between the main research team and a wider PPI network within their own locale. This facilitates equity and inclusive opportunities for involvement across all the partner sites where travel or language barriers may previously have compromised involvement. The development of the hub has been supported by the president of the Trans-European Patient Organisation, the European Huntington's Association. They have been involved as a research partner from the inception and retain a governance role on the study management group. An initial meeting of hub members early on in the study enabled detailed explanation of the study and expectations of the PPI role, allowing identification of further support and training required for our representatives. Subsequently, discussion of the study promoted confident, helpful input from the representatives present, which proved pivotal in the co-development of participant-friendly materials for gathering wider PP input at the annual European Huntington's Association Patient Conference. And here, our hub members were vital in generating discussion of the study amongst the attendees. Further meetings with hub representatives have led to co-development of an additional methodological sub-study for gathering evidence on the most effective methods to encourage study participants to engage with protocols mandated study activities. And now, as we progress to opening the longitudinal study, we are working to support the local PPI and hubs to develop their membership spokes. These spokes will play a key role in the next phase of DOMINO-HD, where the data gathered will be used to inform the co-design of a culturally valid lifestyle intervention. To finish off, here is a short video from one of our hub representatives on their experience of being part of DOMINO-HD so far.
Hello, I'm Barry and I'm a member of the DOMINO-HD PPI group. I've been pleased and impressed with the efforts made by the project team to engage with HD patients and family members from the very start of the project, when they arranged a meeting with all the European PPI representatives. We've since participated in a number of meetings and focus groups to consider specific issues, such as wearable technology preferences and concerns, participation information requirements, patient reminder strategy, etc., etc. I know that our inputs have informed team decisions. I also like the efforts to use the 2019 EHA conference as an opportunity to gather broader PPI input from a larger population. It was good that the team sought guidance from the European PPI team regarding the approach and the materials used. I've also participated in a number of documentation reviews to provide the patient and family perception of the wording used.
Thank you for taking the time to understand more about the DOMINO-HD study. If you'd like more information, you can contact the study team on the DOMINO-HD email address or by accessing the links below. Thank you.